Throughout the pandemic, health department data has shown a disparity between African-American and Hispanic communities when it comes to them being disproportionately impacted by COVID-19. Now that all Hoosier adults are eligible to get vaccinated, the state health department is keeping a close eye on those rates to make sure everyone is protected. WRTV's Cameron Ridle is talking with a local pastor who is bringing the vaccine directly to his neighborhood.
Millions of Hoosiers have been fully vaccinated against COVID-19, and an Indianapolis pastor and his church are doing their part to make sure Hoosiers in Indy's predominantly black neighborhoods have access to that shot too.
People kept being very skeptical about the acceptability, but I said, I don't want to yet say that we have an acceptability problem, and I think we have an accessibility problem. We need to take the vaccine to where people are.
Pastor Clarence Moore of New Era Church has been proactive in using his West Side Church as a vaccination location after partnering with the Marion County Health Department and medical professionals who are also members of his church. New Era Church will vaccinate 50 people with the Moderna vaccine this weekend. He says while appointments for this weekend didn't take long to fill up, it is still a challenge getting people to understand that the vaccine is safe.
They didn't trust the fact that it was a title Warp Speed. They felt like that the scientists didn't do due diligence in making sure that the vaccine was safe.
Hoosiers who show up this weekend will come back in 4 weeks to get their second shot. Between now and then, Moore, who is already fully vaccinated, is hoping to get additional doses of the vaccine and use his church as a vaccine site every weekend in April. This longtime pastor believes if black Hoosiers have the adequate access to the vaccine and the correct information about it, we could even the score that shows more black people getting COVID and less of the vaccine.
And I think if we get the right people to talk about the efficacy and get accessible to that information, I think that we could improve the acceptability.
Cameron Ridle, WRTV.